green light na po yung face-to-face classes. Pilot testing pa nga lang, maybe mga 120 schools all over the country. I'd like to start off with that po. Are you comfortable with that? Well, is the health sector, is the health department comfortable with the idea of going into pilot testing already of face-to-face classes, given the elements of Delta variant, the surge still ongoing, and so on down the line? Are we ready for that?
Yes, sir. Actually, kasama po kami ng Department of Education na gumawa po ng guidelines para dito. We were able to agree on terms on when or what school will be included as part of this pilot implementation. Definitely, we're not going to allow this pilot or these schools to be included if they are part of this higher alert level. So meron po tayong threshold kung saan lang po pwedeng gawin itong pilot schools na ito. And yun po yung mga low-risk areas natin. So, hindi natin kailangan tignan as a region or a place. It might be just a city or a barangay na low-risk siya na pwede yung eskwelahan within that area.
Ang sabi po yung implementation immediate, pero there's no exact date. Can you give us a more or less, siguro ballpark lang, mga next month ba yan or later pa in the year? Ang pagkakasabi kasi immediately.
Well, actually, ma'am, una po, I cannot really give that answer. No? I think it's DepEd to give that answer. But what I can tell you, over these past months, we had been preparing for this. Actually, we had presented this to IATF, I think that was June of this year, where we already were able to identify these schools based on the risk assessment that was done by our schools. And this risk assessment tool has been worked on by DepEd and DOH. So ang kailangan na lang po will be the final operational guidelines wherein on Wednesday po yata ay may meeting na kami with DepEd to have this so that it can be rolled out. So ang DepEd po ang magsasabi kung kailan talaga mag-uumpisa.
So ano po yung basehan at napili po ang kinder, grades 1 to 3, at saka yung mga parang
vocational ng senior high school
classes, no? ng senior high. Bakit po yun?
Yes, ma'am. No? So when we were discussing with DepEd, we decided that we needed to consult our pediatric experts. No? Expert po sa behavioral, na pediatrics, expert po dun sa mga bata talaga. And ang kanilang talagang rekomendasyon ay yung mga mas nakakabata. Kasi sila po yung formative at kailangan po talaga ng interaction kahit na sandali lang sa isang araw. Kumbaga, mas mahirap natin ma-manage yung magiging epekto sa kanila in the coming years if we don't start them right now. Second, the basis for that, sa kanila pong age group, yung pinakamababa na level ng risk of infection.
Ayun, yes.
Yes, and then the third, yun pong merong mga occupational and parang kailangan ng application sa school, iyan naman po pinakausap ng DepEd na uunti lang naman yung mga bata na yan dito sa pilot schools na ito, natignan na rin natin kasi hindi pwedeng puro lahat digital, virtual, yung application nawawala. So they wanted na tignan din natin dito sa pilot if we can already start off with these modules or classes that would require application from the students para naman hindi natin masyado silang nadiderail dun sa kanilang pag-aaral. At yan naman po pinayagan because small percentage lang yan ang isasama natin dyan.
Was there strong opposition from the health experts? Kasi you're doing it in the middle of the Delta variant surge and yung Delta na-apektuhan ng mga bata. And in fact, in the US, merong mga schools na nagsasara ngayon o nagsususpindi ng in-person classes dahil nga mataas yung infection among the children and the teachers. Kahit daw yung vaccinated, maraming breakthrough.
Yes, actually, ma'am, anong pinag-usapan namin to, wala pa tayong Delta variant. Yung cases po ay hindi pa rin naman ganun kabilis na tumataas. So ngayon pong naaprubahan ng ating presidente, syempre pag-uusapan po namin ng DepEd. But definitely, one of the criteria na nakalagay po doon, yung safeguard natin, sa low risk level lang tayo. Isasagawa itong mga pilot schools na to. So we will make sure that all of these schools that will be included, where students will be going already para dito sa pilot na ito, ay nasa low risk lang at wala po yung mataas na risk for them to get infected.
So ano po, magte-testing ba ang mga batang ito sa tuwing papasok? Or may ganun ho ba yan ng mga kasi sa amin, halimbawa sa mga, I know that in most offices, no, employees who are required to report on-site will have to go through RT-PCR testing. So are you going to do the same thing with the kids?
No, we don't recommend that even for adults, ma'am, as to the screening
Oh.
using the test. So we
Yeah.
only do medical screening. And what would be most vital here would be the declaration of the family members and the guardians. Hindi na dapat pinapapasok una-una ang bata kapag may simptomas na. Pagdating sa eskwelahan, hindi naman makakapagsabi sa atin ng bata kung may nararamdaman sila o hindi. So kailangan yung
Yeah.
kanilang safety officer, meron po sila talagang eye for those children, no, na may mga simptomas na. Meron dapat contact tracers na kailangan agad-agad na contact trace and maisasara natin yung classroom kung sakaling nagkaroon ng infection.
Paano ma'am yung
So
asymptomatic?
is this a piloting? I mean, will you be piloting this for, say, a certain period of time after which you expect na gagawin nyo na sa iba pang schools and it will slowly expand until, we get to a certain, manageable percentage? I don't know. So parang pilot test rin ba to? Parang alert level 4 na pinapilot lang muna. Ganun ho ba yan?
Yes, ma'am. No? So this is a pilot among 120 schools only out of the many schools in the Philippines. Ito po ay pangungunahan ng DepEd and I guess pag iayos na po natin yung guidelines, that's the time that we can announce through the Department of Education how long this pilot implementation will be.
So wala pang time frame for it.
None yet, ma'am, kasi katulad ng sabi ko, we had initial guidelines when we presented this to IATF and then we were waiting for the approval of the President and it came today. So kailangan pa ho namin umupo uli ng DepEd because situation then is different already from the situation now.